Hi, I'm Lizzie Dolan. I'm from the N Lab at the University of Nottingham, and we use shopping data, apply AI, and see if it can be useful in health scenarios. So why shopping data? Well, it captures self-care behaviours, often before or during treatments, so those appointments, that time between appointments, perhaps prior to you go to the doctors, or for some people, they might not access healthcare. So this can really complement NHS records or pharmacy data, and it can reveal new earlier signals or inequities in healthcare. So today it's a whistle-stop tour of a few studies using shopping data for health, respiratory disease, ovarian cancer, and bacterial vaginosis. So the first study we did was in respiratory disease, and we were looking to see whether shopping data, so over 2 billion in-store sales, could help to predict respiratory deaths 17 days in advance for over 300 local authority areas in England. And the NLab and myself specialise in AI, so we also applied AI explainability to prove that shopping data could not only predict deaths in an area, but it could add accuracy on top of those traditional variables that NHS were already using. Now, it did this amazingly well, and why it worked was particularly because of cough medicines 24 days in advance. It worked in volatile periods where traditional seasonal variables weren't picking up when mortality went outside of those seasonal norms, but sales data was capturing these variations. And our AI explainability tool showed that without sales data, we couldn't get this accuracy level in predictions. So how did we move from respiratory disease to women's health? Well, I still hear that this shopping data is unrepresentative, and it is in a lot of the data sets I use. It's over 80% women that are generating this data set. But instead of seeing this as a limitation, I saw it as opportunity. If you look at these data sets, women are buying a lot of self-medications in response to their health problems. We started with ovarian cancer with a survey to confirm we'd heard anecdotally women were buying self-medicating products prior to our diagnosis. So this survey confirmed that. It gave us a feature list, so a shorter list of products that women were buying that we could test. And we also tested machine learning techniques on this self-reported data. And even within this study, we found that women who were self-medicating on a doctor's advice were 7 times more likely to have over a year of health problems, and that this subset of women, their distinct shopping behaviours could be identified by the machine learning models. We then went on, and thanks to the clock study, we actually applied these learnings to real loyalty card data, so electronic shopping data. And we found that although the sample size was small, because we found the predictive models were better when the women were comparable in age and shopping habits, we were actually seeing early warning signals. We tested multiple time frames. These were only consistent in 2 out of 3, so a lot of work still to be done. But because it was a small subset, we still think there's potential there. And the products that were driving these were antacids, vitamins, and new clothes. And importantly, this was 5 months in advance of diagnosis. Then we moved beyond ovarian cancer. And why? Because we did a lot of public engagement, and this was the feedback we were getting from the public. Women's health, urogenital infections, particularly affect over 400 million people worldwide. Women's quality of life is seriously compromised by the symptoms, and it also can lead to really serious complications. So serendipitously, Dr. Trish Hepburn got in contact with me to ask about bacterial vaginosis treatments over the counter, lactic acid gels. They had done a study that showed they were a lot less effective than antibiotics, but they didn't know how many women were using these products. So we did a study to see who was treating for self-treating for bacterial vaginosis using these products. And we wanted to see whether the recurrence, the repurchase, and see if there was inequity of care. And we designed two models. One was just to predict who was buying these products, and another was to see who was switching these products. This was really important from the qualitative studies that had done before. And women would say, I just basically man switch, I try everything. So this switching was really important. Very speedily through this slide, we got two great models, and what they showed that there was inequalities driving these models. So we tested this hypothesis just using a simple one Whitney U test, and we saw that women who were switching from a cheaper to a more expensive BV product were more likely to live in areas with higher Black ethnic populations and with higher STA rates, which actually reflects the existing literature on this condition. So very whistle-top store, but hopefully I've shown you that the potential is clear for using this untapped lens on women's health and capturing what clinical data might miss. So thank you for listening.